Support for Disrupted comes from the Connecticut Office of Film, Television, and Digital Media.
It's been 5 years since the World Health Organization declared COVID-19 a global pandemic.
States of emergency have now been declared in 19 states.
The death toll rising here in the U.S. to at least 36, more than 1,200 cases now.
We have no immunity to this virus. We have no vaccines for the virus. Currently, we have no approved treatments for the virus.
Since that time, the world has changed dramatically, from the way we think about public health to the ways we socialize and watch movies. But those changes haven't affected everyone in exactly the same way. From Connecticut Public Radio, this is Disrupted. I'm Kalila Brown-Dean. This hour, we're talking about COVID-19's impact on existing inequities in the world. Later in the show, we'll hear how these inequities played a role in the spread of disease long before COVID-19. But first, we're talking about the pandemic and how it's impacted people with disabilities. Mara Mills is Associate Professor and PhD Director in the Department of Media, Culture, and Communication at New York University. She's co-founder and director of the NYU Center for Disability Studies and co-editor of the recent book, How to Be Disabled in a Pandemic. Mara, welcome to Disrupted.
Thank you.
You know, we really like to be in conversation with people like you because it helps us think about, yes, we are always in these hard, difficult times, and yet there are people doing the hard, difficult work to create better paths. Before we talk about this fantastic new volume that you have co-edited, I want to make sure for our listeners that we are all starting from the same foundational place. And so it's really important for us on Disrupted that we're also clear about terminology. So when you use the terms disabled and disability, share a little with us about what those terms mean and represent in your work.
This is a really tricky question, actually. So in most of our work, what we do in the Center for Disability Studies, we use the word disabled, and we take it from disability activism as a coalitional term, an activist term, sometimes an identity term. That didn't necessarily transfer perfectly into the research we were doing as a group of 30 authors among different disability communities in New York. And the reason for that is a large amount of the research we ended up doing was about groups of people who were newly disabled, people who had long COVID, for instance, or people who had a whole host of COVID or hospitalization and treatment related impairments who might not yet have come to identify as disabled and who might not yet have named themselves as disabled. So we as an author group spent a lot of time asking ourselves this exact question: what do we mean when we say disability in the context of the pandemic? Most of the authors and editors in the volume are themselves disabled, deaf, neurodiverse. I myself am neurodiverse. The minute the pandemic hit New York, even before the governor, the mayor recognized that the pandemic was happening, our communities, the people we work with, live with, or in some cases as ethnographers, as anthropologists work on, were already engaged in mutual aid and activism and their own research about the pandemic that was happening and calling upon the government to recognize it and calling for resources and assistance. So we decided we needed to try to start documenting this. And we brought together, again, 30 different people, not all academics. This book, I should say, is published open access. So it's available for free to anyone on the NYU Press site. And a lot of the authors are community members, librarians. We have lawyers. We have artists, journalists, the first disability reporter at the New York Times, for instance, Amanda Morris. And then we also, yes, have some academics. So when we started, we initially thought, the pandemic, we're hearing over and over again in the press and from government reporting that the pandemic is disproportionately impacting older people and disabled people. And in a sense, that refrain was being repeated with the tone of, no one else has to worry about this. Those people those disabled people are acceptable losses. And we felt that obviously there were two problems with this. One, the voices of disabled people themselves were not being reported on. And those people's own narrations weren't making it to mainstream news, or maybe to shows like this, but not to the New York Times. And also disability and was being presented as a homogenous category, and it's an incredibly internally diverse category. So typically, when I say disability and use that phrase for my center, for myself, I think of it as a coalition of people who are chronically ill, deaf, blind, having mental disabilities, neurodivergent, vast internally diverse category. But with the pandemic and with the research we wanted to do in the city to look at, again, the incredible diversity of disabled people in New York and how they were not all being impacted in the exact same ways by the virus or by city policies, race, zip code, economic background, work status, all of age, living in congregate housing or not, all of these things mattered. And the pandemic as a phenomenon was a social phenomenon as much as it was a biological one. So as we started doing our research, we realized we have to be careful because not all of the groups and people we're interviewing, some of whom are us, some of whom are our neighbors and family members, use the word disability about themselves. So yeah, the word disability is on our title, in the title of the book, but we're very careful in the introduction of the book to explain how that term is used in disability community and activism, but also that some of the chapters in the book are using community terms. Some people simply describe themselves as ill. Some people describe themselves as addicts. Some people describe themselves as just as elderly or having impairments. So there's a lot of different language that comes up from the people we're interviewing themselves or from our communities themselves throughout the chapters. And I'm here speaking on behalf of the book, but I have 3 co-editors and there's 30 authors, and each chapter is its own universe.
And what I think is so important about what you've just shared is that people often use terms and assume that it holds the same meaning. Assume that using a term or a frame of reference applies across all settings. And so what you've just laid out for us is, wait, we are using it in a particular framework. We are identifying the ways that people have organized, built community, built coalition, while still understanding that even as you had government officials, public health officials talking about the disabled, quote unquote, being most vulnerable, it really overlooked the tremendous diversity of experience, of challenge, of self-identity within that category, even as it was meant as a frame of reference. I want to take us back to 2020. And I think, Mara, when we go through collective traumatic experiences, which is what this really was, and I think we should name it, it is easy for people to not forget, but to put things to the side because it is this reminder of where we are. Take our listeners back to what was happening in those early days in New York City in 2020 that made you and others say, there's something happening here that we should pay attention to and be able to understand these stories and experiences and not just chalk it up to sort of an outlier. What was happening for you in 2020 in March at that time?
Yeah, absolutely. I mean, it's very surreal and not intentional that the book is coming out right now. It is the 5th year anniversary. We had a 3-year National Science Foundation grant to work on this. We probably wouldn't have gotten that grant today with the restrictions on NSF funding and disability being a category that's being flagged. So we actually ended up doing 4 years of research instead of 3. The pandemic is still ongoing today. I want to right front and center say that. And it was hard for us to decide when to stop the research. We wrote drafts of each of the chapters, revisited them, revisited the people we interviewed over and over again. And finally, we decided after 4 years, okay, we're going to close the book now, even though the pandemic is ongoing. And that is why the book is coming out at this moment. And it's surreal that it's happening at the 5th year anniversary, because it's also a moment where we are back to another Trump presidency, and we are rolling back many of the few gains, I should say, that came out from the government during the pandemic, like vaccination and masking, which worked. And, we had this unprecedented scientific response around the world to create within a year and disseminate vaccines that worked. All of a sudden, here we have our government, Trump too, is telling us to be suspicious of vaccines and to be suspicious of masks. So there's many reasons why this moment makes it surreal to look back to 2020. But yeah, we started this project in 2020. In fact, those of us affiliated with the NYU Center for Disability Studies started it before March, before the city government and the federal government declared an emergency and started restricting crowds and then shutting down or public spaces and workspaces and moving people to remote. And the reason we started working on it was because disability activists were already working on it. So there were affiliates of our center who are parents of disabled kids who, in their communities, people were already pulling their kids out of schools because they felt there were health risks. Or there are people affiliated with our center who were part of the prison education program, who were already seeing illness sweep through congregate settings like carceral settings in New York City, and seeing the risks that people had in those settings because of not having adequate information and certainly not having any kind of personal protection equipment. We were also seeing lots of activists and artists start to create mutual aid, even in February, mutual aid groups to distribute things like masks to people who needed them, because it was obvious that illness, and that in particular COVID-19, which we knew already existed in nursing homes in Washington State, in Europe, in China, was already in New York. And looking back, we know that people were already dying of COVID-19 before March, when an emergency was declared. So we already had people in our communities who were activated, who were creating mutual aid funds, who were creating, running big Zoom sessions about how to protect oneself in the absence of government protections from becoming ill. We were in it. And so we decided, okay, let's try to get some funding to pay people to research this, because paying people for their labor is also a really important part of what we do. And eventually, with this NSF grant and with some funding from NYU, we were able to put together this team of 30 people, not all of whom are academics, a lot of whom are just people living in New York, disabled activists in New York, and community members.
Coming up, more with Mara Mills, co-editor of How to Be Disabled in a Pandemic. She'll tell us about the challenges of making decisions about a disabled student's education. And later, we'll hear about the relationship between colonialism and medical inequities. This is Disrupted. We'll be right back. Welcome back to Disrupted. I'm Kalila Brown-Dean. This hour, we're talking about the relationship between COVID-19 and systemic inequities. Mara Mills co-edited the recent book, How to Be Disabled in a Pandemic. Earlier in the conversation, Mara talked about people who were newly disabled by COVID-19. Asked her to say more about that.
A lot of activists have talked about this phenomenon. Imani Barbaran, a really important disability activist, really early on social media, predicted that this would be a mass disabling event. And it has been. That doesn't mean all of those people who have contracted long COVID or impairments from COVID are claiming disability benefits. That's been one controversy, but they have new impairments that they have to navigate. We also have journalists like Ed Young who've talked about the hinterlands of disability, and the fact that between non-disabled people and people who died from the pandemic, there's this vast hinterland of disability, people who have temporary disabilities, multiple impairments, who may or may not be calling themselves disabled. And that certainly became clear in the very early months of the pandemic. And a lot of our chapters address how people who were already disability activists became mentors, or sometimes what they would call doulas for newly disabled people. So just to give you a concrete example, there's a chapter by Harris Korenstein and Emily Lim Rogers on MECFS communities, what was formerly called chronic fatigue syndrome, those communities and the ways those communities mentored, provided tip sheets for, had Zoom workshops for people with long COVID. They're not the same thing, but the phenomenons can be similar. Despite the fact that people with MECFS for so many years had not been recognized by the medical community as having a, quote unquote, real condition, or by the government community for benefits. And so that chapter looks at disability doulaship for people who newly have long COVID. And that's just one example that comes out. I mean, there's other examples in the book. There's a chapter written by Chancey Fleet, who is one of the main librarians at the high school branch of the New York Public Library, the branch for blind New Yorkers. Chancey's also blind, tech activist. And it's co-authored with Bojana Kokliat, who's one of the access workers, also blind at the Whitney Museum. And they talked about the mentoring they had to do in their professional settings for getting blind people online, and for working with blind people who were at for very particular set of reasons, a very particular disability community in New York were at high risk of COVID, because so many of the vaccination sites, so many of the testing mechanisms were totally inaccessible. And the work that they had to do to help blind people who might now have another impairment, or who might be navigating just illness from COVID, get online or access a test. So that's another chapter where people are mentoring their own communities as people in those communities are either facing new workplace, housing, or school settings, especially online, or dealing with a new set of illnesses and impairments.
I want to talk about school settings, since you just mentioned that. This book is called How to Be Disabled in a Pandemic. And while it is exploring what happened during COVID and that ongoing COVID pandemic, in many ways, Mara, I think it also is pushing us to think about how we prepare for the next, or how we address and understand people's positioning as they navigate ongoing health threats and challenges. And I'm thinking here of what we're seeing in places like Texas with concerns about measles outbreaks, and how it's bringing us back to that same 2020 question of what do we do in schools? How do we think about educating children, keeping them and their families safe? How we do that while still recognizing that there are many children who are vulnerable for a host of different reasons. And that sort of match between what some people see as a civil liberties question, do I have the right not to, versus do we have an obligation to protect? How do you think about that? When you think about disability, you think about disability communities and these educational settings. What comes to mind for you?
Yeah, we have 2 chapters in the book on parents and youth, or on educational settings. That is an enormous topic. And both of these chapters are either written by people who themselves are educators and parents, or written by people who are, or people who identify as disabled. So, and they're complex chapters because they are not looking at one particular disability community, but looking at, internally diverse groups of disabled students. So one of the chapters is I want to name the people who wrote these so that the listening audience doesn't think I did all of this research by myself. I as the editor, I wrote one chapter and it had to do with ventilator allocation protocols and inequality, especially class and racial inequality in the New York hospitals, about who gets a ventilator. But I didn't do the educational research. So we did have one chapter by 3 former K-12 educators who are now education professors, and they're all parents, and some of them are parents of disabled kids. Alexandra Freitas, Rachel Fish, and Erica Turner. And they interviewed a bunch of parents with disabled kids in New York. They did a huge literature review of, the popular press reportage about disabled kids in New York, and they pointed at a double bind that parents of disabled kids are in. And that double bind is that on the one hand, not all, but many of those kids were at higher risk of either contracting COVID, dying from COVID, or having a severe outcome from COVID if they went back to school in person. And so many parents were hesitant for that reason to send their kids back to school in person, even when the schools reopened. At the same time, many disabled kids were seen as having the worst outcomes from remote schooling. And the reason for that is that they tended to have less access to their either to their, additional supports. Like there was a problem with people getting services like occupational therapy and speech therapy and physical therapy while they were doing remote schooling. There was certainly a problem with people getting having their individual education plans actualized during remote learning. So that chapter looks at this tension that parents had to face of, is remote schooling setting my kid back versus is that a risk that I have to just take because sending them to the schools when it might not be safe yet, or it might not be safe at all. So they don't end with a solution because, of course, the parents of disabled kids is a gigantic category. And there are kids who, from neurodivergence to wheelchair users to blind students. It's this vast category. But that phenomenon, I'm sure, is continues today. The other chapter written by my co-editors, Raina Rapp and Faye Ginsberg, looked at either older youth or young adults who either lived in congregate settings, whose families had placed them either in group homes for disabled young adults or dayhab, and what they faced with those congregate settings being extremely high risk for getting COVID and for spreading COVID, and parents with means being able to bring their kids home to live at home, and parents who had to work not being able to do so. And they investigate the complexities of care workers who, themselves might be at risk having to work, might be low income, often recent immigrants, women of color, themselves being at risk in those dayhab or institutionalized school settings.
I think about 5 years ago, how we would see these videos, these very heartwarming videos of people coming out onto their balconies, onto their fire escapes, hanging out of the windows, banging pots to thank health workers and calling them essential in the work that they were doing. I'm thinking about so many home health professionals who didn't have the luxury of social distancing. They were putting themselves at risk in order to keep other people's loved ones healthy, whether it was the elderly or those who needed a different kind of care. And the ways that we collectively, as a community, as a country, said, thank you for being willing to do that, even if everyone didn't agree with the methods that were being employed to keep people safe, to acknowledge the risk. And yes. I'm thinking, Mara, where we are right now in 2025, when the reality is that the current Secretary of Health and Human Services is on record of questioning, as you mentioned, vaccines, of saying that there are racialized differences or should be racialized differences in vaccine schedules, or questioning the ways that we meet people where they are, because we understand that public health is just that, a public health challenge and priority. Given the work that you do, given this amazing book that you and your co-authors and co-editors have assembled to give that knowledge, what is the thing that you are focusing on in this current climate of let's hold on to this as we chart a path forward so that we have some, not just hope, but also perspective? What are you focusing on?
Yeah. One thing I want to say is that a lot of essential workers themselves were disabled, and we do have 2 chapters on that in the book. One of those chapters looks at by Kara Ryan looks at autistic essential workers in the food delivery industry, and another looks at by Shu Ting Li looks at a senior center in Chinatown in the context of all the anti-Asian violence that was happening in New York, and themselves elders who worked at the senior center with other seniors. So a lot of the essential workers themselves were disabled, and we talk about that as well in the book. One of the way we organized the book in the end, because we were inductively looking across all these different zip codes and communities in the city that our authors had researched, was to think about what we ended up calling the disability dialectic of this incredible creative disability justice response that arose in different ways in different disability communities to meet these conditions of disproportionate risk. Again, the risk not just coming from the virus, but coming from city policies, inequitable city policies, or inequitable hospital and technical policies. And so the first half of the book looks at institutions and policies. And there was a lot of attention in the press to nursing homes and people in nursing homes being at great risk. That is still true to this day. One of our original collaborators, Art Kaplan, who's a bioethicist, has written about his own mother dying in a nursing home during this moment when nursing homes were locked down, and he couldn't visit her, and he waved at her through the window before she died. But there were a lot of other congregate settings like nursing homes that just didn't tend to make it into the press: prisons, migrant detention centers, different kinds of group homes for disabled people. So the first half of our book is somewhat pessimistic and is looking at infrastructure, policy, and the inequalities that certain policies led to. Again, not for all disabled people uniformly. There were certain privileged disabled people in New York, and there were certain people very much impacted by these particular policies and places. The second half of the book, though, is more optimistic. And again, and I say optimistic take this with a grain of salt, but we're not trying to romanticize innovation from precarity here, not at all. What we would like is to see structural change. Obviously, what we'd like in this moment is to see the few gains that we did have from the previous pandemic, like vaccination and masking, be maintained. But that said, we see the second half of the book, the chapters in it, as a repository of disability expertise, of what we are calling CRIP pandemic cultural production. We have a chapter on disability journalism by disabled journalists. We have a chapter on disabled artists creating protest art in New York City throughout, and not just protest art, but mutual aid campaigns like one called CRIP Fund. So that second half of the book is the flip side of the dialectic. It's the disability justice and creative response that came about because of risk, and that wasn't available to everyone. So I also just want to say, people in detention centers or other carceral settings, many of them talked about not having access to information, not having access to communication tools that would allow their voices necessarily to be heard, and not only not having masks and other ways to mitigate the effects of virus, but not having the tools for creative response. So, we have these examples that we want to share of activism, of dueling, but we have a caveat on all of those that, again, we're not trying to universalize disability or groups of disabled people.
That was Mara Mills, co-founder and director of the NYU Center for Disability Studies and co-editor of the recent book, How to Be Disabled in a Pandemic. Coming up, we'll hear about the history of disease and what we've learned about public health since the start of the COVID-19 pandemic. This is Disrupted. Stay with us. Welcome back to Disrupted. I'm Kalila Brown-Dean. This hour, we're talking about how COVID-19 shed a spotlight on existing inequities. But the relationship between disease and inequity isn't new. Historian of science Edna Bonhomme writes about that history in her new book, A History of the World in Six Plagues, how contagion, class, and captivity shaped us from cholera to COVID-19. Edna, thank you so much for joining us on Disrupted.
Thank you for having me. I appreciate having this conversation in this current political moment.
Now, before we talk about this current political moment, because the timing of your book is so critical to helping us understand, I actually want to start at the start of the book. The epigraph comes from W.B. Du Bois's work, Dark Water, Voices from Within the Veil. And I want to share this passage with our listeners because I think it is critical for the work you're doing here. Du Bois writes, "Most men today cannot conceive of a freedom that does not involve somebody's slavery. They do not want equality because the thrill of their happiness comes from having things that others have not." Tell us about that passage and how it shapes the arc of this book that you've written.
As I was writing this book in 2020, 2021, and thinking about the relationship between some of the lockdown measures and the public health regulations, I thought it was interesting to look to Du Bois and to look at him not in the ways in which some individuals were characterizing the lockdown as completely draconian, but to think about very real forms of confinement that happened during Du Bois's lifetime. That is to say, apartheid, Jim Crow, chattel slavery that was present in the US and other parts of the Americas, and considering how confinement in a forced manner shaped people's relationship to each other, as well as the ways in which diseases may spread, or in some cases, prevent it from spreading. So Du Bois served as a kind of entry point for me to consider how to think about history in a dynamic fashion, with a bit of nuance and with also a bit of specificity as well.
You are examining 6 different illnesses within this book to trace that history. Why these 6 illnesses? Why 6? What is it that these 6 teach us?
Originally, I also had wanted to think about the relationship between malaria outbreaks, syphilis outbreaks, and how they impacted society. But I focused on the ones that I did: cholera, sleeping sickness, flu, HIV/AIDS, Ebola, and COVID-19, precisely because there was something about these case studies where confinement became a means for us to understand these infectious diseases and these specific places. So thinking about the plantation and cholera outbreak and how enslaved people may or may not have been considered as people who could actually get genuine care, or even with HIV/AIDS, and heaps of work has been done on the activism around HIV/AIDS. And I wanted to think about, well, what were people who were in some of the most confined spaces, and specifically the Bedford Hills prison, how did they respond to the epidemic during the late 80s and 90s? And to what extent can people, even in some of the most horrific forms of confinement, resist, form mutual aid, and also learn from each other? And so in a sense, the case studies reflected the diversity of experiences I wanted to speak to, both historical trauma and ongoing forms of trauma, but also stories of resilience. I think one of the people who I am quite influenced by is Toni Morrison. And the nuance that I kind of mentioned that I wanted to have in the text also speaks to one thing she said, which is, we die, and that may be the meaning of life, but we do language, and that may be the measure of our lives. And so in thinking about the text and these different epidemics, I'm also thinking about how do we work through the stack of literature that is available to us and make sure that we can make it both beautiful and whole.
I'm thinking here of the pieces of your book where you talk about the Ebola virus and what happened when this entire town called West Point in Monrovia, Liberia, was put under quarantine. And you talk in the book about the social forces that were at play there, which connect to this idea of history and memory and the ways people respond. What would you say were one or two of the most dominant social forces at play during that response to Ebola?
Yeah, so the 2014 Ebola outbreak in West Africa happened in multiple countries. So in Liberia, which I'm mostly focused on in the context of the book, in Sierra Leone, and also Guinea. And in every country, there are a different set of responses. And I thought that the question of what was happening in West Point felt somewhat exceptional, particularly because the neighborhood was put into a lockdown. And this is a working class neighborhood, people just surviving as best as they could. And one of the most surprising things for me in terms of the social kind of and political policies that were put into place was the militarization of the neighborhood on the part of the government to maintain and carry out the lockdown, seeing the images of people, residents being physically attacked, obvious, and seeing the contradiction between this idea that somehow their health was supposed to be monitored and upheld to the highest standards, and yet their sovereignty and physical kind of self-determination was being denied. And so that was quite shocking to me. And I think that what was also difficult to kind of read through is that there was a way that the West African population was also mischaracterized as bush meat eaters and so forth, and how that characterization was racialized, and it couldn't one couldn't help but think that part of that meant that the what they were consuming, the meat that they were consuming, they were being blamed for getting Ebola in that manner.
You know, we are now at the 5-year mark of those first stages of the lockdown. And I'm remembering hearing the stories of people who couldn't go to the hospital to see a loved one, or the emotional toll on healthcare workers who were the last people that someone would see before they passed because others could not be with them. And how do you handle that kind of profound loss? And all the social factors that went into of, yes, we need to keep people safe, but how do we also keep people fed, educated, connected, and who gets to decide what those barriers and boundaries are? You write that this book is a journey toward understanding how disease management is influenced by how society defines humanity. And so as you were talking about the ways that people in Liberia and Sierra Leone and Guinea were characterized as somehow being responsible for their harm or having these negative practices, it sounded a lot like the racism that we heard during the early stages of COVID, where the president at the time was blaming people from China or making comments about that. As an historian of science, and as thinking about the responses to COVID in those early days, what was going through your mind in March of 2020? You're working on this project and experiencing this. What were you thinking at the time?
Yeah, so just to rewind to that period, during April and March of 2020, at the time, the U.S. president downplayed the consequences of coronavirus, presenting it as a nuisance, and in some cases, exaggerating the response that the then Secretary of Health and Human Services had when Alex Azar had declared that this was a public health emergency. And part of that dismissal came with casting the virus as foreign, and beyond that, using specific anti-China comments, and using those terms like China virus extensively while making public appearances. And this was, in my opinion, quite dangerous to put forth a virus and tying it to a nation state or ethnic group, precisely because then people can use that language to then target any individual who might be of that background or perceived to be of that background. And unfortunately, during that period of the initial lockdown, there was anti-Asian violence in the United States, as well as in some parts of Europe. And it's quite horrific that someone's rhetoric and someone who has such a large political platform could do that damage. You pointed to, as part of the question as well, what does it mean, or how do we balance out being able to confine a virus on the one hand and ensuring an infectious disease does not spread widely, while also ensuring that people can see their loved ones, say goodbye, and so forth. And that balance is difficult in these, especially if a disease is quite new. I think that one of the things that we learned from COVID is that there needs to be measures already built into society before an outbreak occurs. In the U.S. context, one of the things that perhaps should be done that is quite available in Western Europe is universal healthcare. So once people actually have a kind of access to healthcare and they know that they won't go into debt because of it, that creates a basis where people can have more trust in the medical system and the institution. But beyond that, one of the things that came out from the COVID initial period of the COVID lockdown was that health workers weren't often paid enough. They felt quite dissatisfied, and some have even left the profession. Another lesson that we should think about is the extent to which we have political forums and platforms and spaces, both physical and virtual, where people are constantly able to have and exchange ideas, evidence-based ideas, that is, so that we're able to truly address individuals' legitimate concerns rather than perhaps relying on fear or scapegoating to carry out certain policies.
I want to bring us to where we are right now in 2025, because you mentioned creating these forums for evidence-based ideas. And that we're in a time when many people are fearful, not just of how do we prepare for the next, but how do we navigate what's happening right now. Some of that fear is tied to the current presidential administration, and in particular, the appointment of Robert F. Kennedy Jr. as the U.S. Secretary of Health and Human Services. I will speak just for myself. Watching that confirmation hearing, hearing his comments about Black people, about having differing vaccine schedules based on race, sounded so much like what we have worked earnestly to remove from medical school textbooks or from nursing textbooks, to develop relationships between healthcare providers and the people they serve so that there's trust on the front end and relationship. And now when we're looking at measles outbreaks and everything else, that fear is driving so much. Help us understand this moment. And what do you say to people who will listen to you, who will read your book and say, all of the lessons that we should have learned from these 6 other plagues, have we really learned? And if not, what's the consequence? What do you say?
As someone who was trained in biology and I worked in a lab after my undergraduate education, that what I often find missing from public discourse is a serious conversation about what science means and what science entails. And when it comes to infectious diseases, a very basic, I guess, principle that is often missing from discussion is germ theory, and the idea that microorganisms such as bacteria, viruses, and parasites can be the primary cause of infectious diseases. And this is important to note because once one has that basis of what germ theory is and how that understanding of it, especially from the 19th century onwards, has helped us understand infectious diseases, is that it is significant to us thinking about public health measures, medical advancements that have kept many societies alive and well. So if not for our understanding of germ theory and 19th century perspectives on public health, we wouldn't have sanitation practices that have allowed us to live longer lives, vaccination and antibiotics, which also help to ensure that we get infectious diseases less often, and so forth. With respect to the present moment, I would say that one of the major issues outside of not having universal healthcare is vaccine skepticism. And the vaccine skepticism has been written extensively about by people such as Maya Goldenberg, who wrote Vaccine Hesitancy. And what she argues is that the hesitancy, particularly in the industrialized nation, has arisen because of a rise of mistrust, a crisis of trust in these places like the US. And also, one could say, too, the rise of alienation in the sense of individualism that can occur. With respect to what I would say is, quote unquote, scientific racism, or this idea that somehow the physical body of Black people is somehow different and can't do quite the things that other bodies might be able to do, that's not new. In fact, there was a whole history of pseudoscience and phrenology that existed in the 19th century, early 20th century, where scientists or people who were trained in science of the time would use that logic, or I would say racist logic, to somehow create multiple tiers and hierarchies of human life. And this is something that Carl Linnaeus did. He was a Swedish botanist and biologist, where he created a hierarchy of life based off of his understanding or categorization of different ethnic groups. I think one of the things that we should try to do is just like that characterization can be a dog whistle for latent racism, and we need to be unapologetic about challenging that so that it doesn't get reproduced. Because if people have a misconception that somehow certain groups of people, whether they be Black, Latinx, Asian, are physiologically so distinct that they are unable to have access to or cope with certain forms of medication, that can be quite destructive, and it can be cause real lives to be damaged over time.
I appreciate that this is a book that presents very heavy subjects, but also reminds us of that resistance, that reminds us of the ways that people are organizing against some of those forces. And Edna, you set out a possibility for a path forward where we can learn from history, we can navigate the present, but really think about what we need to do to move forward. Edna Bono is a historian of science. Her new book is A History of the World in 6 Plagues, How Contagion, Class, and Captivity Shaped Us from Cholera to COVID-19. Thank you so much.
Thank you for having me.
Disrupted is produced by Kevin Chang Barnum, Robin Doyon-Aiken, Meg Fitzgerald, and Meg Dalton. Our interns are Angelica Gajewski and Kathy Wang. You can listen to all the previous episodes of Disrupted by finding us wherever you get your podcast. Just search for Disrupted and Connecticut Public. And if you love an episode, please remember to leave us a comment. You can listen to new episodes every Friday at 9 a.m. From Connecticut Public Radio, this is Disrupted. I'm Kalila Brown-Dean. Thanks for listening.